As a kid, growing up in São Paulo, Brazil, whenever I would get sick, my mom would take me to see the pediatrician, Dr. Israel. And I just knew that going into the office, I'd come out feeling better. And I just thought it was something almost magical that she would take me to see this doctor and then I would come out feeling much better. And so I'd love to go and see Dr. Israel and get a lollipop in the end of the visit, so it was a win-win situation. But I remember thinking, how cool is that? And I remember thinking, that's what I want to do. I want to make other kids feel better. I want to make other people feel better when they come and see the doctor. So for me, that was something I wanted to do ever since I was a kid. And when I went into medical school, I actually rotated through OB/GYN and ended up falling in love with that field instead. I remember the first night of the rotation, I delivered a baby. It was a C-section I was doing with the physician, and I was helping him out. I remember holding the baby in my hands, and I just thought, wow, this is really amazing. And holding this baby, holding this child, everything else around me was just kind of faded away and kind of just blurry, just kind of like how you see in the movies. And I just remember holding this baby, and finally I was hearing this voice in the background, George, 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 hand the baby off. And I'm like, okay. So I handed the baby off, and I just remember, wow, this is amazing. I almost got teary-eyed during that delivery. And I thought, this is what I want to do. I want to deliver babies. And I also enjoyed doing surgery a lot, and pleasantly surprised that the field of gynecology has a lot of surgery in there. And I enjoyed the aspect of that I get to see patients throughout the years and follow their stories, see their children grow up. For me, it was a natural fit. Nowadays, we all have busy lives, and there's social media, there's email, there's running around, work, and I think a little bit of what gets lost is the art of listening, and I think that's what I try to do when I see patients. First of all is listen. Why are they coming to see me? What can I do better, to make their lives better? And I think that's pretty much half the work, is really listening to your patient, and if you're listening to your patient, you're going to be able to take the proper approaches to their healthcare, whether it be medical, whether it be surgical, whether it be their pregnancy. So the way I try to improve women's healthcare is really just one patient at a time. Listen to what they're telling you, and then act appropriately and use your best medical knowledge to really help that patient and improve their lives.